Good evening, everybody. It's Dr. Sean here with the Arthritis Movement. Lesson tonight is about heat and the application of heat in order to help us manage our arthritic conditions and our aches and pains. Heat is an interesting animal in that it feels good at the time, but there is some risks associated with it, especially if there's an active inflammatory process going on. So the mechanism of action for heat as far as creating that feeling of mobility and movement is it does warm up the tissue, it warms up the capsule of the joint, it can soften any thickening in any inflammatory fluid that might be around a joint, therefore making the joint feel more mobile. However, it does also open up all the vasculature to dissipate the heat. This is why we get red around an area that's been heated. It's also why we sweat, is the blood flow to the area, the vasculature is opened up, and that allows more blood flow to the skin, and that allows the heat to dissipate. The problem with it is if there's an active inflammatory process going on, the heat will also bring more blood to the area, and that's how swelling gets there. So if there's an active injury process that is telling the body, I want swelling, and we open up the blood flow to that area, then we actually reinitiate the swelling process or increase the swelling process, which therefore leads to more ache and more pain and more dysfunction later. So we really have to be careful with the application of heat, both in the time we choose to use it, as well as the duration. So where it becomes most effective is in order to facilitate some movement. So if we use some heat on an area that we're having a hard time getting enough movement to do an effective stretch, and if we can increase that movement by 10 or 20% and therefore be able to do our stretches, initiate some activity, then we can get the benefit of that movement, and then we always follow it up with ice. So the protocol becomes heat, relatively short duration. You don't want this massive opening up of all the vasculature. You want to use it to open up to soften the fluid in the joint, to actually get a little bit of warmth in the joint and get things to calm down a little bit. But you don't want it to be on there for a prolonged period of time. So my suggestion is usually under 10 minutes, whether that's in a shower or a bath or a hot tub, or just a local application of heat. Keep it short, keep it brief. Once the area feels warm, then you can initiate some movement with some gentle stretching. Maybe it can move enough that you can walk without a limp, go for a short walk. That activity actually helps to move swelling out of the joint. After you've done that, then you want to attack it with ice, especially if there's active swelling. So those are the kind of the way to incorporate some heat into your routine as far as managing some pain. Generally speaking, if there is pain, we want to make sure we're focusing on the ice to reduce the pain, reduce the swelling response, but we can introduce a little bit of heat in order to facilitate movement, because movement also is a good anti-inflammatory practice. So heat it first, warm it up, make it comfortable, light exercise, non-loading, comfortable movement for a period of say 3 to 5 to 10 minutes max, and then follow it up with a stretch and some ice. Heat from a stress management perspective, you start talking about use of sauna, use of hot tubs. All of these things are kind of represent a challenge to our system. There's great research coming out on longevity. We'll do another talk on use of sauna, use of cold plunges later on, but this is just a brief talk to introduce the concept of heat isn't the devil. It just has to be used carefully and with some understanding of what you're actually doing within the construct of an injured or sore joint. Use it wisely. Feel free to ask any questions and keep us posted. We'll talk to you soon.